NDC flag bearer, former President Mahama, suspends campaigning over happenings with the electoral process he says will not allow free and fair elections.
Make a major statement on this matter in due course, very soon. But in the meantime, I'll suspend the campaign in the Bono region.
Police blame lack of cooperation by witnesses for unresolved murders.
Murders that were done, covertly, it is very difficult to resolve. So it is not that it will not be resolved, but it will take some time to resolve them.
A 13-year-old girl at Parigo in the northeast region is being tormented by ritualists who want to kill her because of her deformity. At best, they say makes her a spirit child.
She was born in this condition, which made some people to call her a spiritual child. We were even advised to eliminate her, but I refused and said she must leave.
Also in this bulletin, hospitals in Kumasi closed down their wards and sent patients away as striking nurses remain defiant.
Doctors are trained in all aspects of care. And where we need support, the support provided. Where it becomes critical, those we can do, like taking of the vital signs, we do that ourselves and take care of the patient.
And in business?
Airlines that fail to have passengers' PCR COVID-19 test to be fined $3,500 per passenger.
Ghanaians will be allowed entry, but subject to 14 days of mandatory quarantine at a facility approved by the government and at a cost to the passenger.
My name is Aisha Ibrahim. Joynews Prime comes to you live from our studios in Kokomlemle here in Accra on your digital terrestrial TV, because we're free to air on DSTV channel 421 and Go TV channel 144. Many thanks for choosing us. In our very first story, the Tema Region Police Command is blaming lack of cooperation from witnesses for a number of unresolved murder cases in the jurisdiction. The commander, DCOP Berima Keneboa Sasraku II, in an interview with Joynews' Kwame Yanka, admitted a number of murder cases are yet to be resolved. However, will not put a figure to it. There's more in the following report.
The following cases remain fresh on the memory of Tema residents. Murder of Marketing and Public Relations Manager of Tema Ports, Josmina Asante. 10-year-old girl, Namyona Tiataje Kujo. 35-year-old herdsman, Sanda Moro at Dawa, among others. DCOP Berima Keneboa Sasraku II has been posted here as the new regional commander and his crime officer for the area. ACP Paul Kisifrimpong held the meeting with the media to answer questions pertaining to these murder cases as a way of building trust between the police and the media and to collaborate more to fight crime in the region.
There are some unresolved murders, particularly in the Pram area, that we are still on investigating. But as you and I know, murders that were done, covertly, it is very difficult to resolve. So it is not that it will not be resolved, but it will take some time to resolve them.
ACP Paul Kisifrimpong reveals some of the cases are going cold due to their covert nature. But the security agency says it is not relenting on its efforts in getting to the bottom of these murders as it seeks information from the media and the public to assist in the ongoing investigations.
That is why, our cooperation with the media is very key, because most people will be much more comfortable, talking to the media than identifying that this is a police officer and you will not want to talk to. So when you are our ears and our eyes, any information that comes to your knowledge, let us also know so that we can use that as the basis of trying to resolve some of these cases. But we are doing a lot of community engagement, so that people will get much more confidence in talking to the police.
For the new regional commander, DCOP Berima Keneboa Sasraku II, land guard activities impeding safety in the area will be another area of priority.
And possibly because some of us will go strictly to the rules,
they may bring in policemen from other jurisdictions into our area. There are times we see some, we chase them out, we find out why they are in our jurisdictions. And whenever it happens that we deal with them. The unfortunate thing is that as we are the press, the distance keeps increasing. We are not able to brief you. And some of the things, they are so internal that it doesn't augur well to make it so public. So whenever people come from outside, we are putting in a lot of efforts, advising the divisional commands, districts and stations that any person who comes there claiming to be a security person should prove with his ID card where he's coming from, so that we'll deal with that issue.
On elections 2020, the command says it is putting in place measures to engage all stakeholders before December. Kwame Yankes reports for Joynews.
In the northeast region of Pariwu, a 13-year-old girl deformed at birth at risk being killed by ritualists over suspicion she is a spirit child. Faiza Saidu was born with a condition which makes her right leg continue to grow longer than the left. Doctors describe the condition as a split-foot malformation, usually resulting from gene mutations. But among her people, the condition makes her none other than a child possessed by evil spirits. Faiza has been confined and denied treatment as a result of the stigmatization and constant threat of being harmed by her mockers. Joynews' correspondent Eliasa Tanko traveled to meet her family, who are fighting off pressure by the community witch doctors to kill her.
The killing of so-called spirit children was a common practice in northern Ghana, where children born with some form of acute deformity or disability were condemned as being possessed by evil spirits. These children were mostly killed by being fed with poisonous concoctions or sometimes buried alive by village elders, otherwise known as soothsayers or witch doctors. The practice was shaped by poverty and ignorance in remote and often marginalized communities in the north. It was said to have originated as a way of poor families to deal with deformed or disabled children that they could not take care of. The practice died down in 2013 following an undercover expose by renowned investigative journalist Anas Aremiao Anas, who tracked down and exposed some of those responsible for the atrocity. However, the practice appears to still exist, as the family of this 13-year-old girl said there was an offer to kill her because she was born with a rare leg deformity. The grandfather of the girl, Issa Saidu, said he rejected the offer. We asked him about ritual killings in the area and why he refused to allow her granddaughter to be taken through the practice as traditions demanded. He explains.
She was born in this condition, which made some people to call her a spiritual child. We were even advised to eliminate her, but I refused and said she must leave. And she has lived till now with the leg also developing as she grows.
Why did he refuse?
I rejected the advice because of fear the parents might not be able to reproduce again, or the same child could have been reborn, as I witnessed in the past, where a deformed was reborn 3 times to the same parents after it was murdered spiritually.
Now he wants assistance from the public to treat the medical condition of the girl.
I am ready to give my fullest support and pleading for help to treat her.
Those involved in this practice perceive it as solution to any problem a family might be having at the time of a child's birth. The child is usually blamed for such sicknesses in the family. However, in the case of this young girl, plastic surgeons, according to health experts, are usually able to improve the quality of life and functionality of the limb through a series of corrective procedures. The orthopedic surgeons are also sometimes involved in order to achieve certain desired outcomes. But due to poverty, the girl is unable to receive treatment and has been confined away from the public eye. Her uneducated parents, who are both peasant farmers, are appealing for help to seek treatment to save the girl's life.
As a first-time mother, I wasn't expecting my child to be like this, so I fainted due to that. I fainted for several moments, and it took all seriously to bring me back to consciousness. And we are praying for help to treat her leg. We have nothing and pleading with those with something to help us. As a mother, anytime I see her in this condition, I cry a lot, but always look up to God.
So tum wala biyo kan sula na wunne no ya fatin bahayina usun fatin bakati mi anya alafia de mon be shima manyo ba nyum nguna bu kanya astin banu manya asim o mama
we continue to pray every day for helper to save her life. Looking at her condition as her father, I am always unhappy at her condition. Her mother also is always troubled. We don't have the financial muscle to treat her. We are begging for help for her treatment and for us to also have peace in our lives as parents.
Ilyasu Tanko reporting for Joynews.
Let's take a while longer on health because scores of patients continue to suffer the brunt of the ongoing nationwide strike by nurses and midwives as they struggle to access healthcare, with most having to resort to expensive private hospitals. The situation has moved from bad to worse in just 24 hours. At the Rich Hospital here in Accra, all 700 nursing staff at the facility are absent and will only resume after concerns on non-payment of allowances and poor conditions of service are addressed by government. Joynews' Manuel Cranting was at the Rich Hospital and now reports.
2 days, 82,000 striking nurses and even more stranded patients. That's the sustained picture at various health facilities across the country since nurses and midwives withdrew their services on Monday, September 21. All attempts by the National Labour Commission to get the nurses back to the ward have proven futile. They say any move by the commission to intimidate them will be fiercely resisted. The apparent feud between the nurses and their employer has left the fate of innocent patients in their own hands. At the Rich Hospital in Accra, scores of patients waited in vain for the arrival of the nurses.
And if your case isn't that severe, maybe you don't have anything showing you should go home, then you have to wait and see just one doctor in this big hospital. So maybe I'll go home and see a private doctor because they are saying, so we hear the nurses are back and I don't know when.
I came so that the nurses would direct me to the doctor. But unfortunately, when I came, they said nurses are on strike. So because of that, if I'm having the lab report, I should go to the house, then wait till the day that nurses will resume back to work.
I'm going to come and look my child at Ridge Hospital. I've heard it, but the doctors are looking at it. They are looking after us, but we didn't see any nurse there.
So you want the nurses to come back?
Yes, we want them to come back. Thank you.
To contain the excesses, management at the facility has redeployed doctors to fill in for the nurses. Dr. Emmanuel Sorpeño is medical director at the Rich Hospital.
It can't really go that far. It cannot be the routine.
because then the doctors are being stretched. Let me give you one example. We have just about 150 doctors, but we have 700 nurses. And so when those 700 nurses are not there, the doctors cannot run their normal duty and then now come and take over the nursing functions. It is not possible, because looking at even the numbers, assuming they could do, but looking at the numbers that have gone away, that is this hospital alone.
He is, however, calling on government to immediately resolve the matter, as the current system being run is unsustainable.
As I said earlier on, the kind of situation we have now is not sustainable. So we are only pleading on government to bring their good offices to bear so that this strike is averted, so that it will not lead to any loss of life or loss of maybe increased morbidity. The kind of system we are running cannot be the way to go. It cannot be the routine. It cannot become the routine.
As fears over possible loss of lives continue to mount, so are calls for an immediate resolution of the impasse. For Joy News, Manuel Kranting.
In the Ashanti region, some hospitals in Kumasi have closed down their general wards and suspended maternity services due to the ongoing strike by nurses. The Suntresa Hospital, for instance, has discharged all cases in the ward, referring some of them to private institutions. Doctors at the outpatient department of these hospitals are multitasking, taking up the role of nurses. Nanaya Ojima has been to some of the hospitals and now reports.
A doctor issuing out instructions to patients at the outpatient department, a duty normally performed by nurses. At the Suntreso Government Hospital, doctors are aided by some hospital staff to provide outpatient services. Dr. Thomas Ejakupoku is medical superintendent at the Suntreso Hospital.
Doctors are trained in all aspects of care. And where we need support, the support provided. Where it becomes critical, those we can do, like taking of the vital signs, we do that ourselves and take care of the patient. So, of course, we have the records where we can get patient for this to writing. And those who will not need critical things may go for their medicine and then go home and come as an outpatient. The basic services we're able to provide, we will provide. We are also not here for taking care of patients, we also give advice and also direct referrals. Sometimes where to go is also important.
The absence of nurses in the hospital is delaying healthcare delivery. Numbers of patients in various hospitals keep rising.
I came here with my elder brother. We were here early in the morning. Around that was 4:30. Yes, we were here. So we have been waiting.
My leg aches. I cough terribly. I'm in pain.
I'm at a table and Timmy Adarova. This means to me, and it's on the buyer. Yes, in the years of the about 5 o'clock.
5 o'clock. I didn't say about them, sir.
I'm not quite about 4. I'm going to say, hey, I'm on holiday to my Yegma. Number under 5 years. 1 month I was saying diabetic patient from 9 o'clock. I won't share.
Maternity services and general wards, where the services of nurses are needed most, have been shut down at the Suntreso Hospital. Dr. Ejakupoku explains.
As at yesterday, we had 2 patients on the ward, but we managed them and then we referred them to other facilities, private facilities.
Executive Director to the National Labour Commission, Ofosu Asamoah, now joins us via Zoom for more. Mr. Asamoah, the nurses are accusing you of intimidating them, but they say they will not kowtow. Where are we now with regards to their demands and their return to duty post?
We are not intimidating. We are not intimidating them. And we only wanted to serve them a process for them to appear before the commission. And so that the case between them and their employers can be attended to. But it was difficult serving them the process. So we had to go to the court for an order for substituted service, which we obtained and have since done so.
So you've obtained another court injunction?
No, we have only one injunction, but serving the order on them, that's the injunction, was quite difficult. So we had to go to the court for an order, excuse me, for an order for substituted service to serve them, which we have done.
And what has been the response?
Oh, yes. Listening to them on several radio stations and TV stations, including yours, they have agreed to attend to us tomorrow at 10 a.m.
But we heard from the Deputy Health Minister who says the issue will be resolved in 48 hours. Anything about that you know? Hello, Mr. Asamoah, you're still on Joynews Prime. I'm saying that we heard from the Deputy Health Minister, Okoboy, who says the issue will be resolved in 48 hours. Have you heard anything about that? And has anything of that sort come to your table?
Yes. We are hopeful that it will be resolved perhaps in less than 48 hours. When they appear before the commission, I mean, certainly, the members are ready to help them solve the problem.
I'm grateful for your time. Ofosu Asamoah is Executive Secretary of the NLC. Let's go to Sunyani rather, because President Akufo-Addo has reiterated his government's resolve to build strong and efficient health infrastructure to cope with current and future demands. For him, the coronavirus pandemic exposed major weaknesses in the country's healthcare delivery that must be tackled head-on. Inaugurating a 100-bed coronavirus treatment facility at Pantai and Dodowa, the president said the government's Agenda 111 will ensure existence of hospitals in each district and the newly created regions.
To come here today and to see this collaboration between public and private entities and the government of Ghana to put up this very critical infrastructure in our fight against the COVID-19 is something which is very reassuring and very warming to my heart. And I want to congratulate all the people who have been involved in this, the Ministry of Health, the leadership of the Electricity Corporation of Ghana, the project coordinator, the contractor, and obviously the public officials of the Ministry of Health for coming together and working so effectively. My understanding is that all of this will have taken, by the time it's over, 3 months to do. That's a very big and commendable achievement, and we should all applaud that matter on their end. So every challenge, every disaster, every challenge is an opportunity. And that is the way we should look at where we are with this COVID-19. It has come, it's caused disruptions, but out of it, we should emerge a stronger country than we were before the COVID-19. That is my commitment, and that is what I'm working for, that we will come out of this thing stronger than we were before we went into the COVID-19.
President Akufo-Addo speaking. There's still to come in this bulletin, a lot more coming up on business. Stay with me.
Hello there, it's time for business. I'm Charles Aite. Airlines that board passengers without PCR test results will be fined $3,500 per passenger. According to the Ghana Airports Company, latest COVID-19 guidelines, non-Ghanaians may be refused entry and return to the point of embarkation at a cost to the airline. Charles Nixon Yeboah has more in this report.
According to the report, airlines that also disembark passengers with positive PCR tests into Accra will be fined $3,500. Ghanaians will be allowed entry, but subject to 14 days of mandatory quarantine at a facility approved by the government and at a cost to the passenger. Arriving passengers will, however, undergo temperature screening. Also, Ghanaian residents who depart Ghana and return within 1 week will not be required to present COVID-19 report from the country of departure. Passengers will then be subjected to a mandatory COVID-19 test at the airport terminal at a cost of $150 to be borne by the passenger. But any passenger who refuses to pay to undergo the COVID-19 test will be subjected to seizure of his or her passport and will be handed to state security agencies. Subsequently, the passenger will be taken into a 14-day quarantine at a designated location at the passenger's cost. Passengers who test positive upon arrival will, however, receive further clinical assessment and treatment. On the other hand, passengers who test negative will be advised to continue to observe COVID-19 safety precautions following arrival in Ghana. With regard to transit passengers, those transiting and transferring through Accra will not be required to take the COVID-19 test in Accra. However, transit passengers will be required to adhere to COVID-19 testing requirements for their destination countries. On exemptions, airline crew are exempted from the pre-departure and arrival from COVID-19 testing, but they should follow the airline policy for testing. In contrast, children under 5 will not be required to undergo testing on arrival at the Kotoka International Airport. For departing passengers, all international departing passengers will be required to adhere to COVID-19 testing requirements for their destination countries. When it comes to traveling with pets, it is allowed in guidelines of the Veterinary Services Directorate of the Ministry of Food and Agriculture.
Now, providing more loans to businesses to turn around their lost fortunes, stimulating economic growth and preserving the stability of the city will dominate ongoing discussions at the 96th Monetary Policy Committee meeting. The meeting, which began today at the Bank of Ghana, will review the health of the economy. But this week's meeting is seen as very crucial in this COVID-19 era. And for that, George Rafi has been explaining.
The meeting, which began earlier today, is bringing together all the 3 governors of the Bank of Ghana, some heads of department and 2 external members. The gathering is going on at a time that COVID-19 has impacted heavily on the economy, with some sectors struggling to recover. Therefore, the Bank of Ghana would want to look at ways that it can use its various monetary policy measures to direct credit to some critical sectors like the hospitality and manufacturing. The Ghana city has also seen some firm stability on the market over the past 3 months, but the concern here is that is this sustainable, or some fresh measures are needed to ensure that the stability is enjoyed for a long time, even going into next year. Some say this is very important because of its impact on stabilizing food prices on the market. It's because one of the main aims of the Monetary Policy Committee is to stabilize prices on the market, a development that could lead to a reduction in cost of credit and living as well. In all, the committee would also want to look at the fiscal side and what government should be doing to aid growth, whilst looking at the debt stock as well as the non-performing loans in the banking sector. The policy rate currently stands at 14.5%, as it was left unchanged at the Bank of Ghana's last meeting. Any review on this rate would definitely impact on the cost of borrowing and that loan that you are currently servicing at that commercial bank or any financial institution. The meeting is expected to end this Friday with a press conference held by the Bank of Ghana next Monday to tell journalists on what the new policy rate is, so the total debt stock and other development in the banking sector.
And that'll be it for business. I'm Charles. IHA The News continues.
Welcome back to Joynews Prime. Now to the rest of our stories. Former President John Mahama says he's cutting short his 4-day tour of the Bono region to return to Accra to deal with what he describes as the many chaotic happenings with the voters' register, which is currently on exhibition for 8 days, describing the voter ID card as the most important element in the elections. The NDC flag bearer said there's a lot happening with the electoral process that makes it impossible to have a free and fair election in December.
Of September, the Electoral Commission started the exhibition of the voters' register. All the political parties have been on the campaign trail, and we've been encouraging our supporters to go and check their names in the new register. Many have gone to check, and in many places there are anomalies, several anomalies that our party has detected. In any exhibition of a register, there will be few anomalies that are normally easy to correct. But we also know that anytime we've done a registration of voters, we have done it in good time, so that if there are anomalies, we can correct them. And let me say, a voters register is the most important document in any election. We will make a major statement on this matter in due course, very soon. But in the meantime, I'll suspend the campaign in the Bono region. There are several constituencies that we're expecting us today and tomorrow and the day after. I wish to apologize to them. As soon as this matter is addressed in Accra, I'll quickly come back and finish the tour of the Bono region.
The party has since released a statement on this development, and excerpts of the statement reads: Presidential candidate of the National Democratic Congress, Mr. John Dramani Mahama, has suspended his tour of the Bono region over concerns about the new voters register. He announced a suspension on the second day of his planned 4-day tour of the Bono region. Vice presidential candidate Professor Nana Jenopo-Kwajman is also cutting short her week-long tour of the central region and addressing a gathering of chiefs and Sunyani magazine workers in Sunyani on Tuesday. Mr. Mahama said there was so much chaos and disorder in the electoral process, adding it has the potential to create crisis in our country. He says the Electoral Commission should be prepared to take the blame if this country descends into chaos. He's also saying it is unclear whether or not we're going to have a credible register because we are not confident of the process that is going on, adding there's too much anarchy and disorder. We are not sure that we can have a credible register with which to have a free, fair and transparent election. Mr. Mahama called on the international community to take an interest in the political development in Ghana. And it's signed by James Ejenim Boateng, who's spokesperson of the Mahama 2020 campaign team. We'll take a break on Joynews. We'll bring you more after this break.
Thank you for staying with us here. And in our first story, the Minister for Youth and Sport, Isaac Isiama, has revealed that Black Stars coach Siki Akono must take at least a 40% salary cut before he can pay. According to the minister, the coronavirus pandemic has drained the finances of his outfit, and hence they cannot pay the $25,000 monthly salary agreed. He was speaking to our sister station, Adum TV.
Sika kono so die no hwe me no ko mu no se me ne efefo no ayengage and me meka asem obi ate your COVID period you need to full payment. It's not possible.
More fire.
It's not possible, sir.
More fire.
And we are negotiating either 40-50% of their contract in Ghana and 60% here. And to the no but we then say we will not pay him full payment for the COVID period.
Until say COVID ni be free.
Say if you want
say better say COVID ni obi man.
Yes, say na say your bobo no dia obi won say ya say na.
Yes, say your bobo dia.
Full engagement or your demand there. Then you can pay full.
That means within the COVID period ni dia muntu full, but yes, say your bobo no muntu o coach dia. Let's say full one.
That's the point. Oh no. We be honest still make say asomasi. Yenya eduma ebi nkwa eduma ebi eduma say na dia. Ono what you say is a Ghanaian.
Bon fire.
Asata so me catch here no. Na me je because o minister say bio me Ghana ni no how in yakum.
So as said in my introduction, Siki Akono basically, according to the sports minister, because of the times we are in, we need to take a salary cut. He also added in that, voice that he said in Chi that when football resumes and funds start coming in, he can get the 25,000 agreed. Meanwhile, Asante Kotoko and Ash Gold will be given a combined amount of $350,000 for their participation in the CAF Champions League and CAF Confederations Cup, respectively. As Ikesiama was speaking again on the same platform.
The government and the Ghana Football Association in 2005 reached an agreement where government will support clubs for their participation in the CAF interclub football competitions. The agreement between the two entities was for government to pay the flight and accommodation of clubs for taking part in continental matches. A fund known as the Revolving Fund was set up where clubs that reach the money zone would repay back to government the monies invested in their participation in the games. However, Kumasi, Asante Kotoko and Accra House of Oak, who reached the money zone in 2006 CAF interclub competitions, failed to honor the agreement. This forced the Ministry of Youth and Sports to grow cold feet towards supporting clubs' participation in Africa. However, in 2018, following the premiere of an expose into corruption and match fixing that led to the setting up of a normalization committee, the Ministry of Youth and Sports gave a combined $350,000 to Kotoko and Ash Gold for their participation in the CAF Champions League and Confederation Cup, respectively. Mr. Esiama says the decision to support the club's engagement in Africa was arrived following the setting up of a policy document.
I issued a policy statement. A policy that was a policy. So far as I will talk about Nekufuado and MPP Abane there, now you're twice to Sana Mona. And for me, you to say Sanjay has come to stay. I hear Juma. To go and read it. Man can say, you're not Fibako and Fame, you know, say Afibor. That's why it's a policy statement by government here. You go so be sa.
Kotokoni has good in Africa.
Oh, I already crowd. How? Let me see.
Kotokoni has.
Let me see. I already money how.
Support Amudi
see.
Sorry, Kotokoni has good.
I buy say I already. How to say? You said there for a kind. Until we are delivering on our promises. The money.
Kotoko and Ash Gold will represent Ghana in the next edition of the CAF Champions League and Confederation Cup, and Mr. Esiama revealed the clubs would be given $200,000 and $150,000 respectively for playing in the CAF Champions League and Confederation Cup.
Policy you can 2 years ago new a year Juma. And I feel so a year Juma I'm a Kotoko Ash Gold near FA as Sanchez Omonko. FA na Sanchez Omonko. Okay. FA Sanchez Omonko dia abana ya said I say almost can the mom ye kind. Nti ye see na me ya adom o mo chase be November na Kotoko eko championship no $200,000 at the hotel mu as good eko competition cup no so no $150,000 put together $350,000 aba bia nya bi da umpe na apede igusu ayeyo because so ayebiu amagana for any agent.
The two clubs confirmed their participation to the Ghana Football Association earlier this month.
That's it for the sport. Let's do this again tomorrow. Gary L. Smith here. Thank you for your time.
So much for staying on the Joynews channel. Now time to cross over to the AMA head office, where the Center for Coastal Management at the University of Cape Coast is currently organizing a town hall meeting with the political parties on the fisheries sector. Enjoy the rest of our programs.